orthotics for heel pain, heel spurs, and plantar fasciitis. And what do we look for as a podiatrist when we're fitting a foot with an orthotic for heel pain, heel spurs, or plantar fasciitis? So before we get started, we'll just run through some information on what causes heel pain, heel spurs, and plantar fasciitis. Now, a large majority or most of these conditions are caused by when we strain a thing called the plantar fascia. So the plantar fascia is a ligament that runs from the heel to the ball of the foot like this. When we overload that ligament beyond its ability to adapt and repair itself. So the motion that usually overloads this is when the foot pronates. So this is left foot, and this is your big toe down the inside here. So if the foot rolls towards the inside and the arch flattens out, this plantar fascia ligament here that runs from the heel to the ball of the foot gets placed under strain. And because walking is such a repetitive task, where most people aim to do 10,000 steps in a day, so that means this left side will be 5,000 times, it'll go down and up like this. So that ligament will get aggravated. So usually with heel spurs is where the plantar fascia attaches into the heel. Plantar fasciitis is where the arch or the ligament that spans the arch gets irritated and inflamed and sore. And then it basically becomes this heel pain, heel spur syndrome where you get pain from the attachment all the way down through the arch. So that's what largely causes a majority of heel pain and heel spurs. There are things that the systemic diseases such as rheumatoid arthritis, you can have some people have food allergies that will inflame their plantar fascia. But most of the conditions we see that cause heel pain are mechanically related. So anything that causes your foot to roll in too far and strain the plantar fascia will aggravate it and cause these heel pain, heel spurs, and plantar fasciitis. So with that in mind, most of the treatments that we do are aimed at stopping that foot from rolling in and straining your plantar fascia. So things that will help to do that are if we can support the arch with an orthotic insole, that will help to keep the arch height high and keep the tension off the plantar fascia. If you've got a tight calf muscle, so the calf muscles are the ones that sit up here that run all the way up to the back of the knee, if we can stretch those off and make those more supple, they become better at shock absorbing, and they also allow the ankle to function more freely, and that will help to limit overpronation as well, because when we have a tight calf muscle, it forces your foot to overpronate. It's a very destructive thing is to have a tight calf muscle. It will actually strain most of the structures in the foot. So the treatment's aimed at supporting the arch and loosening the calf muscles. These are the two big ones that we do with pretty much every patient that has plantar fasciitis. This is the first thing we do. So there's a couple of options we can use for supporting the foot with an orthotic. So we can usually go with an off-the-shelf orthotic like this one here, the Ergonx Ultra Soft. And the reason we use this one is because, one, it's got this really nice high, long arch support, and you can see, if we can line it up in the camera properly, you can see right through here that this actually packs right out through the arch. So you get this nice support down through here. That will help to keep the arch high and take the pressure off the plantar fascia, which will help to rest it so it can heal and it won't be as inflamed. The second thing that we like about this one is it's got this really nice deep heel cup. You can see my finger disappears in there. And what that does, it helps to keep the foot's natural fatty pad that's under the heel, keeps it contained under the heel, and then we also add this extra cushioning poron section right under there, so it helps to limit the amount of pressure right on where that heel spur would grow. So if we have a look back at our model, the heel spur attaches right on this medial calcaneal tubercle here. We can see it's got this little tiny lump that sticks out. And unfortunately, that's often where we weight bear as well. So if it becomes inflamed and then we stand on it, it'll actually feel more like a stone bruise or a bruise in your heel. So it's really important that we keep the foot's natural fatty pad under the heel and then cushion up that area. That doesn't fix the problem, but it just makes it feel a lot better while it's healing. The other feature we like about this orthotic is most off-the-shelf orthotics really just focus on the medial arch support or the inside arch support. This one's actually got this nice little lateral arch support too, so it'll help you to stop rolling towards the outside and overcorrecting your foot. It's made from a really nice soft polyurethane foam, so it does pack the arch up while using bulk under the arch, but it actually feels really quite nice and soft under the foot, and it'll make your feet instantly more comfortable. So that is one of the off-the-shelf products that we use to help to support the feet that have plantar fasciitis. If we need more support than that, what we do is we make a custom-made orthotic where we'll actually you take a 3D scan of your foot, send it off to the lab, and then they'll mill out this one custom-made part which is exactly the shape of your foot. And then what your podiatrist can do is they can wedge your foot to actually correct and make a prescription orthotic, so it'll actually wedge your foot out to the desired position. Usually it's about 4 degrees rolled out towards the outside. But of course, this is not for everyone. That's just for most people. So that would be the next level up that we'd try and support the feet. Now we do this in conjunction with calf stretching, rolling out your calves, and looking at your footwear, making sure you're wearing a good shock absorbing shoe. A running shoe like a Brooks or an Asics running shoe would be fantastic. The Hoka shoes are also very good for helping to treat heel pain and plantar fasciitis. And we can use those in conjunction with an orthotic, an off-the-shelf or a custom-made orthotic, and some stretching and strengthening exercise, and these will really help to move your foot pain along. We also use the basic first aid treatments like icing your foot when it's sore, resting your foot so we don't aggravate it, and cutting out the aggravating activity. If so, for example, if you know you're running and the running's upsetting your heel, we need to cut that out until we can allow your heel pain to heal, and then we can get you gradually back into the running. So that's a brief overview of how we treat heel pain, heel spurs, and plantar fasciitis in the clinic with off-the-shelf orthotics, custom-made orthotics, icing, stretching, and footwear. I hope this has been helpful. If you have any comments, please comment below. Thanks. If you enjoyed this video, please like and subscribe to our channel. It's very simple to do and it really does help us out. If you need further information on the topics discussed, please follow the links in the description, and that will take you to our website where we've got more information on these topics. If you have a specific question that you'd like to ask, please comment in the comments section below, and we'll do our best to make a video to address your question. If you have any further comments or questions, you can find us at ergonx.com.au, and we look forward to seeing you in the next video.